Hi everyone. Just wanted to review some material for this upcoming week for week 7 in our class. I'm going to leave my camera off. I've recorded videos in odd places before, but this is the first time I've recorded a video in a bathroom, so so I'm going to leave the camera off. My husband is in a meeting we're in a hotel room and he's in a meeting in the main room. So I'm going to hide out here in the bathroom and record this video for you all. So this is, again, it's just some lecture material. I apologize I didn't get this up last week, related mainly to the issues with the content, with the text itself. But so I did want to give you some info for this week's material. So I'm going to go over, I borrowed the slides from the textbook itself, but I also, you have a chapter from another text that's posted, and I'll kind of draw some correlations there. So what we're talking about this week in class is really about ethics in areas like research and whatnot, how that's managed, and then also how health service organizations have other resources for ethics as well. So we're going to talk a little bit about those types of committees and whatnot that are available to help out with ethical considerations in the healthcare setting. But to start, the real key is, we have all these committees that we'll talk about here momentarily. There are other ways to manage ethics within an organization as well, but it all rolls up into the overall philosophy of the organization, the moral and ethical standards that are set and expected to be followed, and the personal ethic of the health service administrator. So it really is, it's really kind of where it starts. And as the slide here talks about circles of influence, that's what it's about. If you work for an organization where it's about money first and ethics last, then you're going to have a different situation than if you're always putting patients first, always putting ethical decision making first. And hopefully your administrators will also have that same viewpoint, and you can come together as an organization. It's when you have those organizations where sometimes money seems more important. That tends to be really the ethical dilemma that a lot of places face. It ultimately rolls back to the patients, and let's get this patient out of here. They're costing us too much money. Or, no, we're not going to take that patient. They don't have the ability to pay. And those types of things. Or, this patient's on life support with no next of kin. Let's make a decision to end their life support so that they're not eating up our resources anymore. Those are the types of decisions that, depending on your organizational philosophy, you may have a different decision made by these committees that we're going to talk about. So really important that you have a strong moral and ethical background to start with, and that can come a lot from your compliance program. Organizations that don't have a compliance program or have one on a shelf somewhere in a book, but it doesn't live and breathe, really are kind of behind the eight ball to begin with regard to ethics and how things how things operate. We also, allocation of resources. We talked about that 2 weeks ago now. 2 weeks ago? No, last week was allocation of resources. I think we've talked about it previously as well, distributive justice. But especially in times of pandemic, like with COVID, as we're seeing, allocation of resources can be done ethically or unethically. And sometimes even the ethical decision is painful, but that the way that you allocate resources can have a strong impact on your ethics of your organization. So a few committees here that we want to talk about, and these committees can help us to solve our ethical issues within our organization. So the Institutional Ethics Committee, I've had the pleasure of serving on 2 of these committees. I was not aware of an infant care review committee at the facility I worked at, which was interesting because I would think that we would have had one, but I think that the work of that committee really rolled up to our Institutional Ethics Committee. So I had the opportunity to be on an ethics committee, which was a very broad range. I think I may have mentioned already in the class at some point, maybe in a discussion or in another video the types of things that we would deal with on that committee. Then the Institutional Review Board, you'll typically hear it referred to as the IRB. The IRB is focused on human subject protection in research. So that's another important way that we protect our patients, we protect others that are involved in research, and ultimately you're protecting the organization because it comes down to that. And then the Infant Care Review Committee is specifically dealing with issues related to infants with disabilities. So prior to these very specific committees that most every organization will have, there are all sorts of different types of committees. Abortion selection committee, if there was enough health risk to warrant an abortion back prior to being able to do those things electively. Renal dialysis selection committees. So this was, about resource allocation and distributive justice. Who gets the machines? There aren't enough for everybody. Those types of things. And then a prognosis committee is, kind of sometimes referred to as the God Squad, but they are the ones that would be making the determination on when to withdraw life support for somebody. And back in that time frame, it wasn't necessarily just those that that had no next of kin, because those were in the days before a lot of the advanced directives and healthcare proxy laws that we have now in states. So oftentimes they were the God Squad. They were the ones that made those decisions, hopefully in conjunction, if they're operating morally and ethically, in conjunction with the patient's family, but not necessarily by law at one point. Now that they would most certainly have to have the patient's family involved. Ethics committees, the Institutional Ethics Committee overall, they tend to be involved in lots of different areas. That can be a patient's rights issue, can be a relationship issue amongst providers, could be appropriateness of technology, conflicts of social values, managed care issues, clinical decision-making issues, cultural issues, all sorts of things. Anything that has an ethical twist, and as we've seen throughout the class so far, we're in week 7, everything can have an ethical twist on it. So the ethics committee can get involved in almost anything. And I can tell you that we saw the gamut of things from administrators that were making poor ethical decisions with regard to contracts and those types of things, working with vendors, all the way up to making decisions on whether or not to continue life support for a patient. So lots of different things, and a lot of the discussions quite difficult in the long run. The ethics committee tended to be very much a hospital thing. So hospitals, academic medical centers, those types of places had ethics committees. But in the past years, other areas have had the need to get these committees in place. For example, long-term care, skilled nursing facilities, nursing homes, etc., really need an ethical voice. I think that a lot of the time, the nature of their work can make frontline staff jaded and not necessarily making the best ethical decisions some of the time. So having a committee that one can go to when there's a case that needs to be reviewed, they can review cases, they can make policy recommendations, they can give advice to people, they can get legal involved if need be. But on the nursing home side, we really are seeing that grow, and rightfully so. I think that all we need to do is take a look at the quality of care issues in nursing facilities and realize that morals and ethics are not terribly high, unfortunately, in many facilities across the country. There are some that are phenomenal and provide great care, and then there are others that are just horrible. So, having a strong base in ethics to begin with can help, hopefully, to improve quality of care. Things like integrated delivery networks, HMOs, managed care organizations, they also are in need of those ethical decision-making, kind of advisory boards. So think about an HMO where maybe the medical director feels that there are services that based on policy aren't covered, but ethically they probably should be covering them. Those are the kinds of things that can be looked at the ethics committee level and examined. Individual cases with certain coverage restrictions and those types of things. So it's important to not just have it in the clinical setting, but in these administrative settings as well. As the slide says here, those types of non-acute settings like an HMO, managed care organization, nursing homes, they're going to be more administrative issues and less hands-on clinical type issues. So the role is really to kind of set the tone for the organization's philosophy, educate based on that. Typically that education occurs via a case-based approach. So as they make decisions on things, information is disseminated to the organization and it gives everyone a really good handle on what the philosophy is for that organization. But then they also do policy development, they review individual cases, all sorts of things. Like I said, something simple as an ethics, a personal administrative ethics issue up through making life and death decisions on behalf of patients that are unable to do it themselves. Ethics issues, like I said, the biomedical types issues. They can also do what's known as ethics consultations. So let's say that there is, a concern by a provider in a specific situation. Maybe family is making a decision that they feel is somewhat inappropriate, and they may ask for an ethics consultation. We'll talk about this in a minute, but there is almost always an ethicist on the committee, or at least an advisory to the committee. That would be a requirement. And the ethicist will be involved and examine it from a philosophical standpoint. That's what ethicists do. But then on the other side, you'll also have the multiple different members of the committee who will provide different viewpoints on the situation. One of the things that's key about an ethics committee, actually any of these committees, but especially an ethics committee, is to have cultural diversity on the committee, but then also to have for those that come from less diverse backgrounds, like myself. Obviously, I don't come from a very diverse background, but I feel that I have a decent understanding of what patients may need from a spiritual standpoint or from a cultural standpoint. And I think the key is, even if you're not expert in every area, which none of us really are, but having a sensitivity, having an open mind, understanding what others may think is appropriate for them based on their cultural background. So if we have someone that comes from a different country to receive care in our facility, they may have an entirely different set of ethical principles that they are working on, because that is their culture. It would be inappropriate of us to just simply slap our own ethical principles onto them, and we need to be sensitive to the beliefs and the thoughts and the ethics that are found in other cultures, other countries, whatnot. So it's really, really important. And as the slide states, if we are meeting those needs, cultural needs, spiritual needs, it can be linked to faster healing, less depression. And I think we're even seeing now in this country, hopefully, that physicians are seeing the differences between Americans that come from different cultures. So, for a long time, everyone that had hypertension would be treated the same way. But I think they're finding now that treatment of diseases like diabetes and hypertension and heart concerns and whatnot, the way that you respond to medication, the way that you take medication, participate in treatment, can be different based on your cultural background. And I think that for a long time, physicians and other practitioners were blind to that, chose not to see that. And but now, hopefully, they're kind of seeing some eyes opening, like we're seeing with COVID, that the certain populations. These are all Americans. Everyone that that we're talking about is here within our country, unless they got trapped here before before within the time frame of when people could no longer travel back to other countries. Generally, we're talking about Americans, and Americans of different cultures. African Americans are responding different than white Americans, who are responding different than Asian Americans, etc. So I think that understanding that cultural diversity and making sure that we're sensitive to it is crucial, not just from a clinical standpoint, but from an ethical standpoint as well. So any ethics committee is going to be very much interdisciplinary. So you're going to have physicians, you're going to have clergy involved, attorneys, you're going to have lay people involved. So you can oftentimes volunteer to be part of an ethics committee. Doesn't mean you'll be chosen, but you can certainly volunteer if that's something you're interested in. There will typically be social work folks, case management folks involved, and then also administrators and nurses. That's why I was an administrator serving on the committee. But the key is to have an interdisciplinary approach, having points of view. Obviously, the physician is going to give a different point of view than the clergy person, than the administrator, than the lay person. So it's important to have all of those different points of view. So that's just a brief run through of ethics committees. There's obviously a lot more in the textbook, so make sure that you review that. Next committee I want to talk about is the Institutional Review Board, commonly known as the IRB. If you are an academic facility, if you work in an academic medical center like UPMC, you absolutely have multiple IRBs that you would potentially deal with. If you work in a smaller hospital, you may not have your own IRB. You may have an IRB that is, if you're doing any research in your facility, which most hospitals are, you may have an independent IRB. But RMU has an IRB. Almost every academic facility that's doing research is going to have an IRB. And what it is it's a committee that's put in place, very similar to the ethics committee, where if someone wants to do research on a human subject, and research can be something as simple as a survey, or it can be as invasive as a surgical procedure, all of them need to be reviewed in some way by the Institutional Review Board. And generally, you need to have informed consent for patients that are involved in research. There are some instances where consent is waived, but generally not. So when we think about institutional review boards and the need for them, and I think we have, let me scroll up here a little bit. No, I guess there's not in here. I'll flip over to the other. I'll flip over to the other text here in a minute, but there are some very specific reasons why we have IRBs. There were things like the Tuskegee study and other similar studies where, and I use the word study loosely because to me a study is a well-informed, appropriate research task. And these weren't. They were experimenting on people without their knowledge or without their consent, and there was no respect for the patient as a human. So a lot of different things came into play, and these led to the need for institutional review boards. The one document that it's typically called the Common Rule, based on the Belmont Report, which is noted on here, really talks about these three precepts: respect for persons, beneficence, and justice. And all of those must be met in order to move forward with a study. So we need to have respect, we need to show beneficence, and we need to show justice in our work in order to move forward. And it's a very simplified version, but in order to move forward with any study that involves a human subject. And keep in mind that, we'll just use RMU for an example. We're not doing research. We're not doing a lot of clinical research, drug trials and device trials, but we're doing tons of research at RMU. We could be looking at the way you study, the way you perform in classes, the way, my research area tends to be wellness. So I might be looking at how people respond to wellness plans in their workplace. Another area of my research is HIPAA. So I might look at how organizations are involved in protecting the privacy and security of patients. So all of that is research, because in order to gather information, you've got to get it from a human. So it could be, filling out a survey. It could just be data that was previously collected, or it could be really hands-on clinical research. All of those types of things would require IRB review at some level. So it's an independent committee, much like the ethics committee, and it's going to have scientists, but it's going to have non-scientific members as well. So you're going to have, and I don't know if, no, I guess there's not one in here. Typically, there will be obviously scientists involved. They will have non-scientific members. If you're doing any studies on a prison population, you're going to have a representative from that community involved. Oftentimes we'll have clergy involved in some way if that is important to the organization or important to the research being done. I'm trying to think of who else. You're going to have typically going to have a layperson on your IRB. You're going to have administrators. Again, that was my role in the IRB. I was the research compliance officer, so I was there to make sure they did things legally and ethically. But so that their role is to review research. So a person could be a professor, could be a physician, could be a student, whatever, wants to do a research study that involves human subjects. They're going to do what's called a proposal. That's going to be submitted to the IRB, and the IRB is going to review that. There are instances when people receive funding from the federal government for research. So they might get a grant from the NIH, they might get a grant from Homeland Security, whatever it might be. In those cases, there are very specific criteria that an IRB must meet, and you need to make sure that you're meeting those criteria and meeting the review level criteria as well. So a lot of detail there. You probably don't need all of that detail at this point, but it's important to just have that basic understanding. Just for an example, for pediatric research, there are very specific criteria. You should never put a patient at more than minimal risk. If there is more than minimal risk, there has to be a direct benefit. So, for example, if you have a new drug that you're testing on children, there's probably going to be more than minimal risk, because you never know how someone's going to react to a medication, especially if it's in trial, which means it hasn't been approved yet. But there has to be a direct benefit. So perhaps these patients have no other option, and that's why they're using this drug. There has to be very specific criteria. Expanding the knowledge of the disease, and to help clinicians understand the problem. There needs to be novel. There needs to be new information coming from this research, or we can't put children at risk. Same types of things with prisoners. There were many cases where prisoners were used inappropriately in research because they were kind of they were stuck. They didn't have a choice. They got the care that they were given in their facilities, and obviously that's inappropriate. Prisoners don't lose their risk or their right to make decisions on their own, and so it's inappropriate to do research on them without appropriate consent, without knowledge, etc. So prisoners are another population that's very specifically governed. There's also, if you have studies that are dealing with sensitive subjects, mental health, sexual abuse, other types of abuse, anything that may be very sensitive to the population as a whole, you need to make sure that you're providing very specific benefit, and that benefit is outweighing risk. Now, it could be a benefit to all of mankind, or it could be a benefit to that patient individually. It's going to depend on the study, but the study will be reviewed by the IRB to make sure that there is benefit, and benefit is outweighing risk. So the regulations govern the composition of the IRB. I kind of told you a little bit about what I had experienced. So you're going to have one or more scientific, there's going to be a minimum of 5 members, at least one scientific member, at least one non-scientific member. Sometimes those of us that work as a scientist also become somewhat jaded to what is seen by a layperson or by an administrator. So I tend to take a very interesting approach because I was an administrator and now I'm a scientist. But it's important to have both of those sides represented. So the key is to minimize risk, to make sure that research subjects are equitably selected, protect privacy, confidentiality, protect against coercion, make sure that there's informed consent. Lots of different things that the IRB does. Typically, you're going to have to follow very specific criteria if it's an FDA study, Food and Drug Administration study. But the FDA process for clinical trials is very long, and there are some situations where those consent requirements and whatnot can be bypassed. So that's, again, probably a little more detailed than what we need to know for this class, but very important to know that there are sometimes when this is why it's important that the IRB is knowledgeable about the rules and regulations and they act in an ethical manner, because sometimes you can actually bypass other laws that exist trying to protect patients. There is a set of studies that are known as exempt research. So it could be an observational study where you're not actually interacting with people, you're just observing. It could be a review of just data. It could be an anonymous survey. It could even be surveys that could be interviews, but the subject's information is not tracked, participants' information is not tracked, so ultimately it's somewhat anonymous. There are lots of different areas, and in those cases, the chair of the committee is responsible for conducting that review. There have been some changes to this rule quite recently, but for purposes of this class, and just know that there is exempt research. There are certain types of services, there are certain types of studies that can kind of fast track and not go through an entire IRB approval process, that the folks in charge of the IRB will review and approve or deny those types of cases. And so why is that important, the IRB? That's really focused on the ethics of, as it was said before, respect for persons, beneficence, justice, making sure that we're taking care of our research subjects. Another side of research that is problematic from an ethical standpoint is falsification of data. So I think that someone in class may have mentioned this particular study before, but the one that I think of, this talks about in the 70s and 80s, but the one that I think of most vividly when I think of falsification of research data is the study regarding a physician, I believe in Great Britain, had written a journal article for the British medical journal, The Lancet, which stated that the additives to vaccines could cause autism. And he falsified an entire study that said that was the case. And that was really the start of the anti-vaxxer movement. So even to this day, people will still rely on that completely false piece of research data that was published. Now, how it ever got published, I have no idea, because usually, especially journals of that nature, are very, they really do a detailed review of the data. There's always going to be at least two peer reviewers, sometimes three. And it's done completely blind. So when I do research or I do reviews for several journals, when I get an article, I don't know who wrote it. I just look at the information. And in this case, it was debunked, and the Lancet put out an apology and whatnot, stating that it was completely falsified. But people still rely on that information and use that as their argument as to not vaccinate their children, etc. So there has not been, to my knowledge, a legitimate study that has shown any connection between autism and childhood vaccines. So that's how important it is that we use ethics in our research. Think about the massive nature of the anti-vaxxer movement just here in the United States, and how it was really driven by one falsified research article many years ago. So it's really important that that we have solid information in our research, and that we only publish information that is truly legitimate research and not falsified. It's all about the surveillance piece. So we need to make sure that our IRBs, so a study like that would have to have been approved by an IRB, and an IRB needs to observe the study as it moves along. So they may have to do reviews of the data, etc. So IRBs should be involved in that, and looking at the surveillance of data when things are being falsified in that way. So I'm going to hop over here to the, where is it? Oh, it's here. So you do have another chapter. We have the chapter from the textbook, the physical textbook that you have, but there's also a chapter from this other textbook, Ethics and Professionalism for Healthcare Managers, about research and healthcare organizations. So a lot of this is the same information that comes from the DAR textbook, but I just thought that there was some better info in here about some live examples of things that have occurred. So it's a fairly short chapter, focused on the research piece overall, but definitely worth taking some time to go through, learning about things like the Tuskegee study, learning about what's appropriate, what's not appropriate, the various federal organizations, OHRP, ORI, Office of Civil Rights, whatnot, that are involved in the oversight of research, and just being knowledgeable of those things. So definitely take a look at that as well. So let's go back here. So the Infant Care Review Committee is the last thing I'll talk about. I'm talking about it because it was noted specifically in the textbook, but I don't know that every organization is going to have one of these. I would be willing to bet that the large Pittsburgh area organizations do, but the organization that I worked for did not. And we would deal with these types of cases from within our larger ethics committee. So we might, as you might imagine, if you have an infant that has a life-threatening condition, oftentimes the family is not, although they definitely have the capacity to consent on behalf of their patient, they may not always be thinking clearly about things. When it comes to, we would never want to see anything happen to our child. So they may not be thinking clearly, and that's where committees like this can step in and examine a situation and provide counseling. Offer some counsel to the family, to the provider about, well, here are specific guidelines that we tend to follow for this condition. Ultimately, it's up to the family to make decisions, but these types of committees can help to make those types of decisions. So with this type of a committee, you're going to have, like with the others, you're going to have administrators, you're going to have lay people, you may have, let's say that you have a facility, maybe you do a lot of rehab in your facility and you have a large population of those with conditions like cerebral palsy or spina bifida, or specific conditions that you want to represent on your committee that infants may have. So you may have people that represent that specific disability group. Maybe a patient that has cerebral palsy that is now an adult and has dealt with many of the treatments and whatnot. Have folks like that on your committee. You're always going to want to have legal counsel, either as a member or as an ad hoc member, to provide legal advice. With any of these situations, the need for legal counsel arises sometimes. So really important. You're also going to have ethicists involved in any of these committees. Not so much with the IRB, I don't see, unless you're doing ethics research, I don't see a lot of ethicists, but they may be called upon as an ad hoc member. But ethicists can come in These are folks that have a PhD in philosophy or ethics or something of that nature, and they work with the clinical staff, looking at it from a philosophical standpoint, looking at it from a pure ethical standpoint, as opposed to clouding judgment with finance and policy and administration and whatnot. So ethicists will work with clinical staff. And then sometimes you'll have something that needs to go to arbitration. So, if there's a dispute that cannot be resolved, you'll have an arbitration procedure where an impartial third party will be involved in the decision-making process. Hopefully that's helpful. I think that, it's the last slide. Hopefully it's helpful. Obviously, these types of committees, you're definitely not on your own as a healthcare administrator. You've got tons of committees that can help you to deal with patients, to deal with providers, to navigate these difficult issues from a bioethical standpoint. But then they can also, ethics committees and ethicists can help with administrative ethical problems at times as well. So sometimes you may bring an administrative issue to the ethics committee. Ethics committee may say, well, we don't want to deal with this as a committee, but here's our ethicist. Work with our ethicist. Maybe they can serve as an impartial third party, something like that. So there are resources available. I think the real key is, and I see this from reviewing your case study work. This is the reason that we do so much case study work in this class. Your upbringing, your background, your experiences, all play into how you see a situation. So on a single case study, I could have 4 completely different answers. And it doesn't mean that any of them are right or wrong. But I could have 4 completely different answers. And I know that it's not based on, I know you're all good folks. So it's not like, oh, well, that person is really immoral, so that's why they're not making that decision in this way. It has nothing to do with that. It has everything to do with your experiences, your upbringing, etc. So that's where someone like an ethicist can come in and look at a situation. And the key work of an ethicist, and this is what you'll be doing in your final project, is to really look at both sides look at both sides of an issue, look at both sides of the equation. You can't make an ethical decision without considering the other side of the issue. So just to say, well, I am pro-choice and that's all I know, it would not allow you to make the appropriate ethical decision at all times. You need to consider the other side of the argument. After you consider the other side of the argument, you may fall back on, well, I am just that way. But having an understanding, just as we talked about with cultural diversity, you need to have an understanding and a sensitivity to others. It's no different here. We need to have an understanding and a sensitivity to others' points of view. We need to remain open-minded as a healthcare administrator. In your personal life, you can do whatever it is you might want. But as a healthcare administrator, we need to remember to be open-minded and to have sensitivity to the fact that others may not have the same viewpoint as us. And we can use these resources to help us navigate that at times. So that's all I've got. Hopefully this is helpful for our content this week, and look forward to seeing everyone in the classroom. Thanks.